Hi, I'm Amy Hanner, Medical Aesthetician here at Westerville Dermatology and Aderma Medical Spa. And today I'm going to demonstrate a microneedling on Jillian. And before we get started, Jillian wants to address some acne scarring as well as just toning, the tone and texture of her skin, which microneedling is indicated for that, and there's just a lot of advantages. With microneedling, as you will see, we take actually very small needles, which the patient, again, as we will demonstrate, doesn't feel a thing. The treatment is literally pain-free because we put topical numbing on top at least 20 to 30 minutes before treatment. I'm wiping that off right now. And before we get started, again, these tiny needles actually make microscopic channels into the dermis without compromising the surface of the skin, the epidermis. So, and what that does is it's like a controlled injury to the skin, but it actually gets to the dermis where the collagen and elastin is, and it actually helps promote new collagen. So that's why it's so wonderful for skin tone and texture, because there's actually a tightening on the skin, and again, it's also indicated and does wonders for some acne scarring as well. Now Jillian, as you can see, she does have some acne along the jawline here, and I will be avoiding that area because we want to be sure not to cross-contaminate. And again, I made sure that Jillian, before our session, I made sure that she was off all of her prescriptions, including Retin-A, at least 3 to 5 days before the treatment, which is imperative. Now I'm using a peptide gel with hyaluronic acid as the gliding agent, as you can see, and we're going to go ahead and get started now. I'm going to start at the forehead. And the end point that I'm looking for is just the tiniest little blood mark from the pass that I just made. I'm going to titrate up 1 notch. And it's important too, as you're doing the treatment, to hold the skin taut. Makes the treatment much more effective. Jillian, do you feel anything?
Nope, not at all.
So you're comfortable?
Yeah, it feels like a vibration.
And that's what I absolutely love about this treatment, because the benefits are huge, especially for, you know, the results that you achieve. And when you consider that the epidermis really does stay intact, and that there's literally minimal to no downtime. And you just go in just like dime-sized circular motions. Just spread the gliding agent around in the area that I'm going to be working on. And again, then just hold the skin taut and just go over it. And as you can see, again, just the tiniest marks on Jillian's forehead. She's not in any pain. And that is the endpoint result that you want to see when doing the microneedling treatment. So now I'm moving on to the cheek area. Spreading the gliding agent around before I get started. You okay, Jillian? Do you feel anything?
Nope.
And again, I just can't say enough about this treatment as far as production of your own collagen. And, you know, when you think about the benefits and truly how economical it is as far as the treatment, for the benefits that you're receiving with little to no downtime, It's just a tremendous treatment to be able to offer our patients. Okay, and as you can see, we're just finishing up the treatment. We're finishing up on her nose now. She's been very comfortable through the whole treatment. And like I said, the only downtime is that today I don't want her sweating at all. So I would tell all my patients, no working out or anything like that. Take it easy the rest of the day. And they always leave here with a post-op kit, our Neocutis post-op kit, which that contains Hyalus as well as Bio Cream, which has human growth factor in it. But outside of applying the post-op, the post-op treatment, that's really it. Like I said, no sweating the rest of the day. And then tomorrow she's going to wake up and just wash her face gently. And then make sure, as always, after any treatment here at Aderma or anytime, everyone needs to use a physical SPF, especially after a treatment. So, again, the post-op cream twice a day, and just to make sure that she's always covered in SPF. And her treatment is complete. As you can see, we're going to wash her up now, and she's just going to look sunburnt. The blood that you see is going to go away. And then tomorrow she can have makeup on, and people won't necessarily even know that she's had a treatment today. This is the finished product. And Jillian, again, how do you feel?
Fine.
Awesome. So that's it. Like I said, once we clean them up, they just simply look like they might have like a sunburn the day of. And then tomorrow morning, she can put on her makeup after her SPF, and she's good to go.